My name is Matthew Hershak, and for fun I like to hang out with my kids, my wife, and I also participate in martial arts, where I'm an instructor and a black belt.
On or off duty, Captain Hershak stays on the go, but years of selfless work and dedication to his activities began to catch up with him. Lower back pain began interfering with his life.
My pain started a lot of years ago, just at work, a lot of wear and tear. You just tweak something here and there, and then about a year and a half ago, it got pretty intense, and it just became unlivable at one point. Pain was on my lower back, and it was a burning feeling. It was crampy, and it just kind of hung out in the lower part of my back. Just went from the whole left side to the right side, and it was just constant and intense. And there was a lot of times where I'd be doing activities and I'd have to go sit down, and stretch out. And but there's a lot of times that there was nothing I can do to make it feel better. The only other thing I was experiencing was my left foot. I was getting drop on my foot. So I'd be walking and, I'd trip once in a while and just not really think anything of it. And there's a couple times I almost fell on the treadmill and not realizing until I got evaluated that my foot is dropping because of the pinching of my nerve. So it was interesting to find that out.
Like many Bonati surgical guests, he tried different conservative methods to treat his pain before considering surgery.
I wasn't on any prescription pain meds because it's something that I really don't believe in unless it's something that's really necessary. And even as bad as my back was, I'm just not a person that would want to take pain meds, so I dealt with it with the ibuprofen. I'd have to take ibuprofen before I go to bed. Otherwise I'd wake up and be in a lot of pain multiple times a night. Before I found Dr. Bonati, I was doing chiropractic care at one of the local chiropractors. And I've been doing that for a really long time. He's made a lot of things feel better. But the lower back pain just didn't seem like it was going away. So he recommended me going to a sports medicine doctor where they did injections, and they talked about doing an ablation. I received 6 injections, and they were right around the areas that I'm having pain, and it was in the facet joints. Basically, it was a diagnostic injection, and it took the pain away for a couple days, and then it came right back. When the doctor recommended an ablation, he explained the process to me, and that it was going to be deadening the nerves in that area, and that it can last anywhere from 6 months to a year, and then I'd probably have to have it repeated. And he mentioned that other patients that have arthritis have it sometimes 3 times a year. And when I figured out the cost of it and how it was going to cost over $1,000 each time, I said, that's unacceptable. I need to find a way to get rid of this pain forever, instead of just deadening the pain.
Feeling certain the ablation wasn't going to solve his problem, Captain Hershak sought a second opinion from the Bonati Spine Institute.
I heard about the Bonati Spine Institute from a good friend of mine. He's actually one of my Aikido instructors. And he had several procedures with Dr. Bonati, and he'd been having great success with it. And so he was the one that recommended I get a second opinion and try to figure something else out. Prior to going to the Bonati Spine Institute, I had submitted all my information, an advocate had contacted me, and then while I was at the gym, Dr. Bonati personally called me and went over my chart and kind of laughed. He was like, oh, you're pretty young to have pain like this, what's going on? And I explained to him, working at the job and this and that, and I appreciate how he took the time to call me. I appreciate how he was very open and honest about how an ablation wasn't going to work, and he in fact even said that if I got an ablation it'd probably last a week and I'd be back in pain. He says that's not the area where you're having pain. He says your pain is your discs and the nerves coming off your spine. He says it's not the facet joints.
He scheduled his consultation knowing the staff at Bonati could fully eliminate his pain, not just offer him a Band-Aid.
I was really impressed how everything is on campus. All the imaging and, all the surgeons are right there and nursing staff, and it was very cool just to go through that whole entire process. The surgeon that I met with when I went to the Institute, it was Dr. Bonati. He was a very cool gentleman. He came in the room and he put my chart up on the screen and he says, I'm gonna go over where you're having pain, where I think you're having pain, and what we're gonna do, and let me know if that's where you think you're having pain, and he kind of went over the chart and explained to me what he's seeing in the MRI, and he goes, "This is where I think you're having the issue." And I was like, "Yep, dead on. That's where I'm having it." I felt like so confident at that point because this guy knows what he's talking about, because that is exactly where I'm feeling my pain. This is what I'm experiencing. And it felt very reassuring that it wasn't just me saying, "Hey, this is my pain." And he goes, "Well, it could be this or that." It felt very reassuring that, he knew exactly where the issue was.
Captain Hershak had one multi-level procedure at L4-L5 and L5-S1.
Before my procedure, they explained to me the conscious sedation part of the procedure. And I just thought that was fascinating because, most people, they go into surgery and they're out and then they wake up and the whole surgery is done. But they were letting me know that, you're kind of going to be like in a twilight state. We're going to wake you up and we're going to have instruments in your back and you'll be awake for that and aware and able to answer questions for us. And we want you to let us know whether you're feeling pain in your back or feeling pain in your leg. And I don't know if they were pulling on nerves or what they were doing, but they touched one spot and I went, "Oh, leg. And then they touched my back and I went, "Oh, that's my back." But then once they told me to arch back up, I just put my hands on the table and propped up and didn't have any discomfort in my lower back. It was all gone. My pain was gone before I even left the operating room. When I was in the recovery room, they had me get up and walk. And I walked from one end of the room to the other, and the doctor actually stopped me and said, "Why are you walking like that?" And I said, "Like what?" And he said, "Walk heel to toe, put your back up straight, stand up straight." And that was something I wasn't able to do for a while. And it was a very emotional experience, knowing that, wow, I can actually walk the right way. My back doesn't hurt, and that was a big eye-opener, big emotional eye-opener for sure.
The Bonati Spine Institute has been fortunate enough to help people like fire rescue, professional athletes, and law enforcement get back to their physically demanding careers. Should you be suffering with chronic pain, Captain Hershak has a piece of advice. Don't wait.
It's kind of scary when you're working in a field and you wonder if a back injury is going to, take you out of work. So you can't do your job, and now I'm able to do that job. Martial arts is one of the things I love. And a lot of times the pain would be really bad and I wouldn't be able to perform like I need to. And just going to class and then coming home, I'd be in agony laying on my bed. But I would push through it and, deal with it. But definitely since all that pain is gone now, it's been a great improvement in my life. I think if somebody's suffering in pain like I was, don't hold out. Don't get stuck, taking pain pills and you got to go get it fixed. If it's something that's able to be corrected, it's worth the time to go in there and get it done.